whether or not you are a candidate, and the special offer that we're
You
able
heard
to
it?
give you.
Oh, never mind.
All right. So, and if you could mute yourselves, that would be really helpful. All right. Dr. McHale, welcome.
All right. Hi, everyone. I'm Dr. McHale. I am the current fellow in cornea, cataract, and refractive surgery here at UCI. So I'm going to be talking a little bit about refractive eye surgery, in particular laser refractive eye surgery. And I'll go into a little bit, what it's for, what it does, what types of surgery we offer, and feel free to ask any questions throughout the entire time in the chat. I think everyone has access to the chat. So I have it pulled up and I can see them live. So ask away. I'll address them as we go or at the end. And we'll go from there, okay? So the first thing I want to start with is, what are the reasons to have laser eye surgery? And most people have some sort of refractive error in the eye. And what refractive error really means is you can sort of imagine if you have a camera that's out of focus, it's changing the focus of the built-in lenses in your eye, the two built-in lenses being the cornea and the lens, so that you can see more sharply at whatever distance we are targeting for without spectacle glasses or contact lens correction. So by far the most common is nearsightedness, which is what we call myopia. Nearsightedness means that you can see better up close than you can far away, whereas farsightedness or hyperopia means that you have better distance vision than near. That being said, people who are very farsighted or very nearsighted likely have poor vision at all functional distances without spectacle correction. And then there's a different type of poor focus called astigmatism. You've probably heard that term many times in, contact lens ads and things like that. And what astigmatism really is the shape of your cornea or the shape of your lens system being a little bit non-spheric. So more like a football than like a soccer ball. And that's something that is also correctable within certain degrees with laser vision correction as well. And then the last and most universal type of refractive error is something called presbyopia. If you are 44, 45 or older, you're probably starting to have some experience with this. And presbyopia is the fact that as everyone ages, their ability to shift focus from distance to near gets weaker. And this is why, older people require reading glasses, whereas younger people don't. And it tends to be more symptomatic in people who are farsighted or have very good vision their whole life because they are not nearsighted. And so they have to shift their focus to get up close vision. And as they lose that ability, they start to be symptomatic younger. Whereas a nearsighted person has onset of the presbyopic symptoms later in life. Okay, so in nearsightedness, like I said, distance is blurred, but up close vision becomes more clear. In farsightedness, it's the opposite. People tend to get a little more, whichever one they are, they tend to get worse with age. So farsightedness especially tends to get worse with age. And then astigmatism is, relevant in that it can be, a safe amount of astigmatism, or some people with significant amounts of astigmatism may actually not be candidates for refractive surgery because that astigmatism points to an underlying condition that prevents us from doing laser surgery safely. And that's going to be a big theme of this talk because, UCI, our number one goal is safe surgery in all the surgeries we do. And we take a lot of care and have a lot of knowledge because we have a lot of cornea specialists in underlying corneal diseases that may make laser surgery unsafe. And so I think we are particularly well suited and particularly good at screening out patients who should not have laser surgery. And I know this is meant, we're trying to get people encouraged to do laser surgery, but I think it's the most important thing to know is that if you are seeking to do laser surgery, you want to go somewhere where they are wise enough and experienced enough to say you're not a good candidate, if that is true. And that's something that I think we excel at. And then again, presbyopia is the decline in focus as you age, ability to shift your focus up close. So what are the types of laser surgery that are done and that we do? By far the most common is something called LASIK. Less common, but equally effective and very, very good is something called PRK. And I'll talk a little bit about the differences between the two. And then there's a newer type of laser surgery called SMILE that we have only sort of just started dabbling with, in that a lot of surgeons are, starting to adopt in the United States, but I think there is less long-term data for it because it's a newer procedure. So we are taking our time to adopt it until we are, comfortable and safe with it. So what is LASIK? LASIK is a surgery wherein we cut with the laser a flap in the cornea. And if you see these pictures, the cornea is the front part of the eye, that clear thing that is almost like the watch face glass that sits over the iris and the pupil. And it's the first lens of the eye, and it's actually what does most of the bending of light for the eye. So we make a flap, which we pull back. We use the laser, a different laser, to change the shape of the underlying cornea, and then we put the flap back in place. In contrast, PRK, we don't make a flap, but rather we rub off the surface skin cells of the eye, and we do the laser directly to the front surface of the eye. And this has some benefits. It's better in people who have thin corneas. It's better in people who don't want a flap in the front of their eye. And that might be people who are, boxers or do things that might predispose them to getting poked in the eye or eye trauma, or, basketball players or athletes, because there's always a risk with LASIK that the flap might dislocate traumatically later in life. Although it's rare, it's certainly possible. And so PRK tends to be a good option for people like that. And the big difference between LASIK and PRK is that LASIK, the healing is much, much faster. We lift the flap, we ablate the tissue, we put the flap back, and within a day or two, you're feeling a lot better. The vision is pretty clear. PRK, because we rub off the skin surface cells, it takes a few days for those to grow back. And so we give a contact lens and pain medication because the first day or first evening after PRK, it hurts. And that's just sort of the reality of what it is. So, we are careful with who we choose for each one, and it's always a conversation between the doctor and the patient as to which refractive surgery is optimum for that patient. But, both of these we have a wealth of experience with and are very, very comfortable with. PRK, we say often one eye at a time because of the pain. It's just doctor philosophy, whoever you get. In my perspective, I think 2 days or a day and a half of being in pain is enough. So why not do both eyes, try and keep comfortable for a weekend and get it over with, but everyone's different. And we say usually for lower corrections only, not necessarily true. We can use this for some higher corrections because it has the benefit of taking or affecting less of the tissue. And so we can actually use it if people have thinner corneas as an option as well. Okay, so who's a candidate, right? Who can we correct? Nearsightedness up to a -12 diopters in your glasses. Farsightedness up to a +6. So if you have glasses that you're, -7, -8, nearsight, LASIK is likely an option for you and likely a life-changing option for you. And same with astigmatism up to 6 diopters. That being said, if you have 6 diopters of astigmatism, in all likelihood, you have an underlying condition that makes you probably not a good candidate for LASIK surgery to begin with. But if we're diligent and careful about ruling out those people, we can correct a large amount of astigmatism. And then there are other things we can do with laser vision correction. There's one thing called monovision. Monovision is where we set one eye for distance, one eye for near. It's often a strategy that we use for cataract surgery. And the benefit of it is that it can, really address this problem of presbyopia, or the inability to see near as you get older. But it has downsides. We tend to only do monovision in people who have tried it out with contact lenses and really liked it. Otherwise, it can get a little confusing for the brain, and to do it permanently without having tried it, I think, is not advised. So I would usually do that in conjunction with an optometrist who will prescribe contact lenses, have the patient try out monovision for a few months, and make sure that they like it. And if their brain adjusts to it and they are happy with it and they want it, we can make it permanent with laser vision correction. So, what are our results? For corrections within normal range, our results are excellent. For corrections in the extreme ranges, they are a little less certain. But in general, right, you will not find a LASIK or refractive surgeon that will promise 20/20 vision. That being said, most of our patients do accomplish that. But the vast, vast, vast majority of patients achieve uncorrected vision that allows them to shop, work, drive, do all the things they need to do without glasses. And there are opportunities for enhancement procedures within 1 year if the physician and you come to an agreement that that is medically appropriate, if there is a need for remaining optical correction. So that's what we say our goal is: go about daily functions without depending on glasses. And that's what we strive for when we do refractive surgery. So what are the things that can go wrong? Because anytime you do surgery, it is certainly possible that things can go wrong. First, over or under correction, need for an enhancement procedure, not quite hitting our refractive target. It's certainly possible. We have, I think, the latest available technology, including something called an eye trace wavefront aberrometer, which is a fancy, fancy word for a really, really expensive machine that does a very, very personalized plan for your laser correction. In the olden days of laser surgery, way, way, way back when it was, 15 years ago, right? That's pretty recent. It's all very recent. But we used to base it based on basically your glasses correction. And now we take in a lot more data, including what glasses prescription you like, but also these really advanced technologies that really get personalized correction. Halos and glare are certainly possible. With this new technology, it's really a lot less common and a lot less of a problem, especially for treatments within what I call normal range, which is -6 to 7 in a nearsighted person, or 3 to 4 in a farsighted person. This is the most common issue, which is that people who get laser surgery, particularly LASIK, will experience more dryness. I'll tell you up front that you will experience more dryness in the months after surgery. And the most common reason is that you had pre-existing asymptomatic dryness that sort of revealed itself after the inflammatory burden of having had surgery. This is another reason I think we really excel, because the same people who are performing the laser surgery, be it myself, Dr. Ahmad, or Dr. Garg, Dr. Fareed, Dr. Wade, Dr. Lee, Dr. Kadar, all of us are specialists in dry eye. And so this is a good place to be to manage your pre-existing dry eye and to manage it preoperatively and postoperatively if needed. So let's talk about LASIK at UCI. I think I've talked a little bit about it. We use the Intralase, which is actually based here in Irvine, and we have an excellent relationship with this company. We use the custom wavefront optics that I discussed. The newest one is called iTrace, and we have it now, which is excellent. And so you can see a little bit about how we make our laser flaps. It's made with the laser. It's really, really highly repeatable and has excellent outcomes. I've talked a little bit about presbyopia already. It's inevitable, just like death and taxes, right? And there are ways we can address it with laser vision correction. Although, if presbyopia is your primary issue and primary problem, I think a longer conversation between you and your doctor is warranted, rather than jumping directly to laser correction, as there are a lot of new options that have sort of been developed that can address this problem. So something to think about and talk about with your optometrist and ophthalmologist. But certainly there are options regarding laser vision correction that can help it. So, those options, there's monovision with LASIK or cataract surgery. There's multifocal lenses when you do have your cataract surgery. And then, it's a $1 billion question. Whoever can fix presbyopia will be just as rich as whoever can fix baldness, because this is something that, happens to everyone as they age. And there's certainly a large amount of research in this. One other type of refractive surgery, and this is something that it is for really, really very nearsighted people, is something called clear lens extraction, which is just basically cataract surgery in a young person. And this is, it's not laser surgery, it's manual cataract surgery, and it's an alternative to LASIK for people who really, really are not candidates, and something that, if you prove not to be a candidate, is certainly possible and able to be discussed with your surgeon. And the same is true for multifocal lenses. This is true for people who have cataracts. I'm not going to go too much into this, as it doesn't really, it's not super relevant to laser surgery. But if your problem is a cataract, laser surgery is not the answer. So I frequently have patients that come in and say, I want LASIK, I can't see. And we look and they have cataracts. And the reality of modern cataract surgery is that it is a refractive surgery that we think of in the same refractive terms that we do LASIK or PRK. And so there are options regarding cataract surgery that can address your refractive error, and we treat as a refractive surgery. And so I'll leave it there for now. And so these are some of the multifocal lenses. I think that is all I have on the laser aspect, but I'm certainly available for any questions, be they specific and personal or general, and feel free to either type them in the chat or unmute yourself and ask them out loud, and I'm here to answer anything we have.
Thank you, Dr. McHale. Does anybody have a question they would like to ask while we have the expert on?
Hi, my name is Tammy. I have a question. So if you do get laser surgery, of course, after all the exams and making sure it's appropriate, is this a lifelong correction, or would there be some kind of vision loss as I get older?
It's probably the best question to ask, Tammy. So thank you. That leads me to what I should be saying, right? It depends, one, how old you are, right? So LASIK, if you are in your 20s, 30s, 40s, I think LASIK is great, because it is going to give you, 15, 20 years of really, really excellent vision. And then certainly you are subject to the same changes as you age that anyone else is, right? So LASIK isn't going to prevent you from, or your eyes from, aging as a normal eye would age, right? The way to think about it is, if you have excellent vision, right, and someone else doesn't, and then they get LASIK to have similar vision to you, you're now at the same point they are, right? So be it a 20-year-old or a 30-year-old or a 40-year-old. So once you have LASIK, certainly there is late regression where sort of a nearsighted person may end up, 2015, 2010, but then 20 years down the line, they're, a little bit nearsighted again. Certainly possible. In addition, if you are nearsighted and you get LASIK, right? So let me give the following example. Say you're a 40-year-old, right? I don't know how old you are, Tammy. I'm not going to make any assumptions. I've learned never to ask, but say you're a 40-year-old.
I'm 59.
59, okay. So say you're a 59, right? So you are already experiencing presbyopia. Your natural lenses that you were born with are losing every day a little bit of their ability to shift their focus distance to near, right? Now, if you are a 40-year-old who is a -1 or a -2 nearsighted person, right? You probably won't have problems with presbyopia until you are 60, 65, right? Until you're really advanced because you're nearsighted, so you won't notice, right? But if you're 40 and then you're a -2 and you get LASIK and you're distance corrected, you will start experiencing problems with presbyopia when you are 45, right? Because now your vision is shifted at distance, and now your inability to focus up close becomes more of a problem, right? So that's, I think, the biggest thing that I teach people and I talk to people about before I do LASIK, because there are a lot of situations where I can add to people's lives, right? But you have to tell people what you're taking away to, right? Or they will be very, very upset down the road. So certainly you're still subject to presbyopia. Certainly if you're younger or approaching presbyopic age, it can speed up when you would be symptomatic, particularly if you're farsighted or nearsighted, excuse me. And finally, you are still subject to getting cataracts, right? So Tammy, you said 59, right?
Yes, correct.
I don't know how nearsighted or farsighted you are, right? But what I would recommend is, why don't you go see how significant your cataracts are? Because maybe at 65 is the right time for you to get cataract surgery, and it's not super worthwhile to get refractive surgery now.
Okay.
And I say that, doing a very poor job advertising, right? But that's the reality, is that because the best thing about our department at UCI is truly we're not like a laser surgery center. We do a lot of laser surgery, but we're the same doctors who do cataract surgery, who do cornea surgery and cornea transplants and manage dry eye. So we have that perspective of, I'm not trying to sell you on any one technology. I'm trying to make sure that you make the right decision for your eyes, for your long-term vision.
Great.
That's how we approach it. So it ends up being really, really specific to your vision and who you are as a person.
Okay, great. Thank you very much.
Of course. All right, so I have a question here from Giovanna Carrera Plancarte. What is the minimum prescription for LASIK? If I have a -2.5 myopic prescription, is that too low to consider LASIK? Absolutely not. That is probably the average or normal. That's an excellent, prescription for LASIK, because you are glasses dependent for driving, right? Your glasses dependent to, I don't know, to see far away, to watch TV. LASIK, that's a perfectly okay prescription for LASIK. Would I do LASIK on someone who's a -0.75? Only if they were like a pilot, then if 20/20 vision at distance is mandatory, we have, but it just depends on who you are, what your lifestyle is, what your goals are. But certainly -2.5 is a very, very normal prescription for LASIK. Yes, so Janice is asking a great question. How stable does your vision have to be to undergo LASIK? We usually say stable prescription for 1 year. But it's a question that's simple to answer simply and complex to answer complexly. There's a lot of factors that go into what stable vision means. But normally we'd say a stable prescription for a year. And the reason for that is that there are disorders of the cornea that can cause your prescription to change rapidly over time. Those disorders we have gotten really good at screening for. And so just stability of prescription, which used to be the go-to for how we rule that out, is now probably the least technological way to address that. And we do a lot more testing, including the ability to have genetic testing, topographic testing, and a lot more data going into that decision. At what age can you do LASIK? My daughter just turned 18, too soon, or wait. 18 is a perfectly reasonable age to do LASIK. I would say, the right age to do LASIK if you're really interested, 18 to 20. I think people in their 20s, LASIK's excellent for them.
Dr.
I
McHale,
don't know actually what we charge these days, so I'm gonna refer to Dana for that data.
I can tell you that, but also before I do, is there some length of time for which a person's prescription needs to be stable before they're a candidate for LASIK?
We usually say 1 year.
Got it. In terms of the cost, so if you go to one of our fellows like Dr. McHale or Dr. Ahmad, the fee for both eyes is $2,500. And if you go to one of our faculty, our specialists, it's $5,000. Now, when you go to one of our fellows, Dr. McHale can explain to you, but you're getting not just the fellow, but also one of our 3 cornea faculty members. So do you want to explain, Dr. McHale, how that works?
So the way we operate, there are 2 fellows who are fully trained ophthalmologists who are doing, it's myself and Dr. Ahmad, who are doing an extra year of training in cornea transplant surgery. And in addition, we are doing extra training in refractive surgery with some of the leading specialists in the region. So from our perspective, we work with and hand in hand with Dr. Garg, Dr. Wade, Dr. Farid, Dr. Lee, Dr. Kadar, who are incredible surgeons. And the way I see it, right, the procedural part of LASIK and PRK is of the surgeries that we are trained to do, one of the least complex. And what I think makes the difference between an incredible refractive surgeon and a less incredible refractive surgeon is the experience of knowing how to plan the refractive surgery properly. And what I mean by that is coming up with a customized and safe plan for each patient, addressing their particular needs, their particular lifestyle, their particular risk factors, and collecting and using the right data to make that decision. So while LASIK, the procedure takes 10 to 15 minutes, LASIK, the consultation, LASIK, the decision-making takes considerably longer. And so that is really where my training is ongoing. And the value of, I think, and the reason why I don't hesitate to say that I think having surgery with myself or Dr. Ahmad is totally safe, is that we are doing it with these specialists. So the entire planning is in consultation with them. And the surgical procedure itself is done with them standing directly next to us. So, I think it's very, very safe. I've done enough now that it's not particularly nerve-wracking or challenging relative to the other things we do. But it's definitely something that if you are interested in, we're always available to meet you in person, to talk in clinic, and yeah, no pressure. It's your eyes, so always recommend making the decision that you feel comfortable with.
One thing to note is that if you do make an appointment for consultation for LASIK, and you don't wind up going forward with the procedure, either because you're not a candidate or you change your mind, there is a fee for the consultation. But in many or most cases, that can be put through insurance as an eye exam, but I can't speak to that. You'd have to talk to the doctors and to your insurance company. In terms of, does insurance cover it? Again, 99% of the time, no, it's considered elective surgery. There are apparently extenuating circumstances, like 1 in a million, where I have heard that it has been covered by insurance, but generally speaking, the answer is no.
I've never seen it be covered, but I don't know what those circumstances would be. Truly, yeah.
There was another question about how long does the correction last? I don't know if you addressed that.
Yeah, how long does it last? It lasts forever, right? But I say that with the extenuating circumstance that you are still subject to the same rate of change that someone else is. So if you're 20/20, you may not be 20/20 forever, right? And I cannot predict when your eyes sort of will age. I can't predict the rate at which you'll get a cataract. But certainly, if you're a -8, right, and you get LASIK and you're plano distance corrected 20/20, you may regress a little bit over the next 10, 15 years, but you're not going to go back to what you were, if that makes sense.
In what circumstances would you do a touch-up?
I do touch-ups when the patient doesn't meet, for whatever reason, and it's happened very, very rarely. But if you saw on our first slide here, the goal we set out, which is general spectacle independence for most parts of life.
There's another question in the chat. It might be easier if you just read that one rather than I read it to you.
Shada Abazari asks, does that mean that if you were in your 20s and were considering LASIK surgery down the line, would it be to your benefit to do the surgery sooner rather than later? Is delaying the surgery for a nearsighted person less beneficial? No, it's not less beneficial. I think 20s, 30s, 40s are all great times to do LASIK. I think that's perfectly okay. It's only when people start getting in their 50s, 60s that I start to hesitate and say, let's just pause, really consider. I'm not saying I wouldn't do it, right? But I would just say, let's really think about what your future holds, what your options are. Giovanna also asked, can you get LASIK twice in your lifetime? Sort of. You can get LASIK. So you can get LASIK, you can get a touch-up on the LASIK later, where we lift that same flap and can make some adjustments. That's certainly possible. And you can get PRK after you get LASIK. Yeah.
Great. Are there any other questions for Dr. McHale? Well, thank you, Dr. McHale, for giving a great presentation. If you're interested in booking a consultation, you can call 824-9970, which is our refractive line, or you can message me where you RSVP'd and I can give you that information. And if you have no more questions, we'll thank Dr. McHale for his time and wish you all a good evening.
Thank you.
All right, thanks everyone.